Hi, Dr. Ramsey Choucair, and we're continuing a series of videos that help patients become educated about cosmetic plastic surgery. So today we're going to talk about optimizing your results after a facelift. So facelifts are a procedure that have withstood the test of time by taking skin that has relaxed and is loose and repositioning or elevating it back where it needs to be to give you a refreshed look. And we've talked about in other videos the three principles to make sure a facelift looks normal: the proper pull so it's not pulled abnormally, not to distort any hairlines which are noticeable if you're sitting next to someone who's had a distorted hairline, and not pulling the earlobe down. Those are the basic principles. We've talked about those in other videos. But what do you do for the surface of the skin? Because I tell all patients, we're repositioning your skin. We're making your skin folds better, but we're not making the surface of the skin better. And the analogy I love to use is basically the analogy when you take a bed sheet out of the dryer. I know it's kind of corny, but it really works. You take a bed sheet out of the dryer and you throw it on the bed, and there are folds everywhere. So you go to the head of the bed and you pull it taut, and what happens? The folds are gone. That's the facelift. But you haven't ironed the wrinkles out of the sheet. That's the surface of the skin. And that's the thing that after a facelift, the looser surface skin clearly looks better because you've pulled the sheet, you've tightened it. And so the wrinkles in the sheet that you haven't ironed still look better, just like in a bed sheet. But ironing the sheet or making the wrinkles in the surface of the skin go away requires different techniques, whether it's resurfacing with a chemical peel or a laser or dermabrasion. Some fine lines and folds can be filled with filler. But again, they're two separate things. So taking care of your skin after a facelift is critical to obtaining the best result. Again, many times patients will see wrinkles before surgery. They could care less afterwards because the facelift has created such a nice improvement. But in some cases, with patients who have really significant sun damage and wrinkles, you can't make those lines go away, and they desire other treatments. Of course, staying out of the sun, doing proper skin care, hydrating your face, all the things that our estheticians in our office educate patients about. So remember, when you do a facelift, it's not the whole story. You haven't ironed the wrinkles out of that sheet.